Here we are gonna to discuss the ECG. ECG is composed of the P wave, QRS complex, and the T wave. When we are discussing the ECG, our main purpose is to focus on the P wave, QRS complex, and T wave. P wave representing the atrial depolarization, and QRS complex representing the ventricular depolarization, and the T wave represent the ventricular repolarization. We are focused on the P wave duration and the QRS complex height and its width, and the T wave its height and the duration. And we are also to focus on the ST segment. Further we proceed. This is ECG. ECG lead is composed of lead second, lead third, and AVF. This represents the inferior wall MI. Inferior wall, when there is a MI of inferior wall, then there we find the abnormality in the second wave, second lead, third lead, and the AVF. V1 and V2 represent the septal part, and the V3 and V4 interior wall of the heart. Leads first and AVL, and V5 and V6 representing the lateral wall. Further we proceed. Here we are focusing on the abnormality which is presenting the ECG. When there is a P wave normally is composed of 3 to 5 small scares. When we are focusing on the ECG strip, we find the 3 to 5 small scares PR interval. That is normal. When there is a above than 5 small scares, it means the ECG is prolonged PR interval. It is then the first bundle branch block. When there is a PR interval short, means it is less than the 3 small scares. It presenting the Wolff-Parkinson-White syndrome. And QRS complex, that is normal, is composed of 3 small scares, and when there is a QRS complex wide, it represents the bundle branch block, either maybe the left or maybe the right. When the QRS complex is tall, it represents the ventricular hypertrophy. And the ST segment. ST segment may be the elevated or maybe the depressed. ST segment elevation represents the infarction, and the ST segment depression representing the ischemia. And T wave, tall T wave represents the hyperkalemia. Further we proceed. Here we find the ECG. ECG here representing that you can see that there is a tall QRS complex. We say that when there is a tall QRS complex, it represents the ventricular hypertrophy. Next we proceed. And here you can see it is in the second lead, third lead, and the third lead, second and third lead represent the ventricular hypertrophy. Further we proceed. Here we focus on the second lead and the third lead. Here you can see that there is ST segment elevation. ST segment elevation will represent the infarction. It means that there is an infarction, MI. And the MI second and third lead, it means there is an infarction of the inferior wall of the heart. Further we proceed. Here we present see that when there is a small number of QRS complex on ECG strip, that represent the bradycardia. When there is a heart rate is less than 60, ventricular fibrillation. When there is a QRS complex are more than the normal, and the ventricular tachycardia. Here we then see that it is the ventricular tachycardia, atrial fibrillation. Here we see that the P wave is more than that of QRS complex. Atrial fibrillation, atrial flutter. Atrial flutter is actually short tooth appearance, supraventricular tachycardia, and tosa dependent. It is sign like signature like wave. Tosa dependent. Asystole, and there is a flat ventricular flat line on the ECG.